Hello friends, we will discuss about general principles that will help a nurse to prepare for a nursing procedure. It is very important to prepare for a nursing procedure well in advance. If adequate preparation is not done prior to doing a nursing procedure, it may affect the safety of patient and the reputation yourself and your hospital. Mainly we can divide the preparation for a nursing procedure into 4 stages. Number 1, before approaching the patient. Number 2, preparing the patient. Number 3, during the procedure. And number 4, after the procedure. We will discuss about each one in detail in the coming slides. Step 1, before approaching the patient. This step to be completed before you reach at the bedside of a patient for a procedure. Check records to identify and verify the procedure ordered, and special instructions to be followed. It will help you to understand indications, contraindications and special precautions to be taken. If any additional order or special consent is required, obtain it as per hospital policy. Explain the procedure to the patient and get his or her permission. Wash your hands and gather required materials and equipments that are required for the procedure. Do not forget to obtain assistance, if needed. Step 2, preparing the patient. This step is to be implemented at the bedside before you start the procedure. Introduce yourself to the patient. Check wristband of the patient or ask his or her name to ensure that you perform correct procedure on correct patient. Explain the procedure to the patient, including what he or she will feel and is expected to do during procedure, including the position he or she has to maintain. Answer to the queries of the patient if any. Do not forget to make relevant assessments about the condition of the patient and his or her special requirements. Provide privacy. Even if the patient is in a private room, you have to provide privacy by drawing the curtains. Arrange all articles within your reach. Use good body mechanics. Position the height of the bed as your convenience and help the patient to maintain position as per the requirement of the procedure. Step 3, during the procedure. Wash your hands before you start the procedure. Maintain standard precautions as per requirement and hospital policy. Maintain sterile techniques. Try to follow the principle of minimum touch. Maintain correct body mechanics during the procedure. Ensure the safety of the patient during procedure. Observe the patient while performing the procedure to understand his or her responses to the procedure. Performing the nursing procedure is an art and skill, so demonstrate coordination in handling equipments. The last major step is care after the procedure. Evaluate patient's response to the procedure. Leave patient in a comfortable and safe position and the call bell within reach. Dispose biomedical wastes immediately according to hospital policy. Wash hands after the completion of the procedure. Finally, document the procedure, patient's responses, and your observations in detailed manner.